Today I'll be doing my disease project over the Rocky Mountain spotted fever. It is a fatal disease that is usually caused by the bite of an infected tick with Rickettsia group bacteria. Some of the symptoms and signs are headache, fever, muscle pains. A rash may be present, frequently with blackened or crusted skin at the site. Rickettsia species have been isolated from embryonic chicken eggs and human embryonic lung. Blood samples may also serve the purpose, but they should be collected carefully to avoid hemolysis. These are stored in tubes containing heparin to help culture the disease with the rickettsia and rickettsii. It is preferred to be stored at negative 80 degrees Celsius, no more than 204 to 48 hours. Rickettsia is managed with adequate antibiotics and antifungal drugs in the first 72 hours. Replication slows down at extremes of 32 to 40 degrees Celsius. Rickettsii reside in host cells and takes two different hosts to complete its life cycle. Once it gets into the cell of any host, it uses binary fission to reproduce and infect more cells within the host. The phases are the lag phase, exponential phase, stationary state phase, and the death phase. Rickettsia is transmitted to the human body by the bite of infected mites or ticks, or by the feces of infected lice or fleas. They enter via the skin and spread through the bloodstream to infect vascular endothelium in the skin, brain, lungs, heart, kidneys, liver, gastrointestinal tract, and other organs. Early signs and symptoms are non-specific. This is why it becomes difficult to diagnose Rocky Mountain spotted fever. But some signs and symptoms are fever, headache, rash, nausea, vomiting, stomach pain, muscle pain, lack of appetite. Usually begins within 2 to 4 days of manifestation. Fever can leave a person with a permanent damage such as hearing loss, mental deterioration, paralysis, or even amputation of some of your extremities like legs, arms, things of that nature. It's important to listen to your body. Go to the doctor, get regular checkups, evaluations, exams to try to rule out some other possible diseases or to catch some things early and can be treated to avoid things like amputation. Diagnosis of rickettsia includes culture, nucleic acid amplification, and serology. The latter test includes rapid diagnostic tests, indirect immunofluorescence assays, and ELISA. Those are some of the tests used to diagnose the disease. Because dogs have been the most common host for transmission, community-based programs have been proven to significantly reduce the numbers of cases. Other strategies may be adapted as in arranging seminars for enhancing awareness among the common people. The management of this disease, they usually try to use the antibiotic doxycycline. It is a treatment of choice for Rocky Mountain spotted fever. It is recommended in patients of all ages. That's the choice of antibiotics they try to use is doxycycline. In worst case scenario, if you have an allergy to doxycycline, they try to use another type of medication called chloramphenicol, if I'm saying it right. That's the alternative. Sulfur-containing drugs may worsen the condition, so if are prohibited. That's about wraps it up. Thank you.